Let's continue to count down the top 2023 advances in breast and gynecologic cancer. I'm Dr. Eleanor Toplinski, board-certified medical oncologist, and we are down to number 3. And today we're talking all about immunotherapy updates that we saw this year. 3 big updates that I want to touch on. The big update this year is in immunotherapy in uterine cancer. Prior to this year, the standard of care when we needed to give chemotherapy, typically for stage 3 or stage 4 or recurrent disease, was carboplatin and paclitaxel chemotherapy. This year, we saw the presentation of the NRG GY018 and the RUBY trials, which looked at the addition of immunotherapy either with pembrolizumab in GY018 or dostarlimab in the RUBY trials to the carboplatin and paclitaxel chemotherapy. And what these studies showed was the addition of immunotherapy to measurable stage 3 disease, stage 4 disease, or recurrent endometrial cancer improved progression-free survival. And so that's quickly become the standard of care. So instead of giving 2 drugs, we're now giving 3 drugs. Of course, there are nuances, but that's kind of the overall picture. And an important point is that the addition of immunotherapy does not depend on MSI or MMR status, which has been or is used more in kind of second line therapy in people who have not previously received immunotherapy. Second big update in immunotherapy has been in cervical cancer. Now, right now, we use pembrolizumab for advanced or stage 4 cervical cancer that is PD-L1 positive in combination with chemotherapy. This year, we saw the presentation of the KEYNOTE A18 trial, which looks at adding pembrolizumab to locally advanced but not metastatic cervical cancer. Currently, we do radiation with chemotherapy. This study looked at adding immunotherapy to that regimen and showed an improved outcome. So we're still waiting for that approval, but hopefully that will become the new standard of care in certain cases. And lastly, in the breast cancer setting, we saw some updated data in KEYNOTE 522 trial, which confirms using immunotherapy, pembrolizumab with chemotherapy for neoadjuvant treatment of stage 2 and stage 3 triple-negative breast cancer, and then following with immunotherapy afterwards. And there are several other ongoing studies, but those are the top 3 immunotherapy updates that I think are practice changing in the breast and gynecologic cancer space. I'd love to know your questions on immunotherapy, your experiences with it. If you've had it, let me know.